Welcome to 101nursing.com, and today we will be talking about angina. What is angina? Angina is chest pain, a fancy way of saying chest pain. Chest pain, this is caused by atherosclerosis. Atherosclerosis is hardening of the arteries due to buildup of plaque and fatty deposits within the arteries. And there's various different types of anginas that we will get into. There is stable angina. Stable angina is angina that can easily be resolved by standing still or after the angina occurs, you stop what you're doing. If you're walking up the stairs and you're feeling chest pain, you stop what you're doing and you sit down or you rest and the angina subsides. That's chronic stable angina. Next is paroxysmal angina, and it's coronary spasm, your coronary spasms. And it can primarily be caused at rest or by smoking. So smoking cessation smoking cessation will help with that type of angina. Next is microvascular angina. Microvascular angina is myocardial ischemia, is MI secondary to microvessels disease and coronary artery disorders. There's nocturnal angina, angina that occurs at night or at rest. Angina that causes that is at rest. Angina ductus, also at rest. You're laying down and you feel your chest pain, and you sit up or whatever, and your chest pain subsides. And that's it for the angina. Well, actually, there's also one more angina, unstable angina, and that's due to rupture or of thickened plaque. And if the plaque has ruptured, you cannot control it, and that's essentially leads you to an MI, myocardial infarction. Ways that we can treat angina. Treatment of angina is rest, oxygen, and nitroglycerin if you are at home by yourself. If you have chronic stable angina, this is what you will be taught. You'll have nitroglycerin, and nitroglycerin is to be placed in the dark. It's a medication. You place it under your tongue. It should tingle or burn, and if it's not tingling or burning, it's either expired. And nitro can last up to 2 years, 2 to 3 years. But if you don't know how old that nitro is and you're having angina, my best bet is you take that because you better have something or nothing. And common side effects of nitro is headaches, because it's a vasodilator. It not only dilates your arteries, but it also you can have hypotension that can occur with that. So if anybody is touching nitro, expect headaches. And there's topical nitro as well. First occurrences. If this is your first time, what's going to happen in the hospital? So in the hospital, they're going to history and physical. They're going to do a 12-lead EKG. You're going to get a chest x-ray. You're going to go down for cardiac enzymes to see if you have troponin leakage. Troponin can indicate MI, myocardial infarction. And then you'll have your stress tests, your exercise or nitroglycerin and nuclear stress tests. You can have a CT scan, and you have different labs. Your CBC, your myoglobin, your lipid panel, your BUN, creatinine, cardiac troponin, cardiac marker, your marker. And so with that, we'll go into, and that's your diagnostic studies as well. We're going to go into depth with that, with unstable angina.